Hi everyone, very good evening to each one of you. A very warm welcome to all of you guys. Myself, Dr. Vaibhav Jain, and today we will be discussing about the medicine. Right? What are the important topics we are going to see? We are going to discuss about the medicine. I hope all of you are doing good. Please give me a quick confirmation so that we can proceed with the session, guys. Let me know whether I'm clearly audible and visible. Hello, Krishna. Hari. Hi. Right, so today we are going to start it off with the medicine. I'm good, Hari. Mumtaz, Surya. Very good. Just give me a moment. I'll just connect with the screen. This is the last phase of your preparation. I hope all of you are doing good. This is the important time. You have to remember you should not give up at this particular point of time. You have to work consistently. Whatever you have been doing since last 4 months is going to help you now also. Right, just keep the pace, don't lose the hope, right? This is the last time you have to remember this. You should not lose the hope. I'm doing good, guys. I'm doing good. Screen is not connecting. Just give me a moment. Till then, try to tell me how's your preparation is going on. Being anxious at this point of time is okay, guys. It's completely fine if you feel anxious, if you feel like you don't know anything. That is going to be okay. That is the normal thing. Then it is the normal thing that we are having. But make sure you don't lose the hope. Make sure you don't give up. That is the most important thing that you have to do, right? Sorry for the disturbance. Just trying to reconnect. Great. I really hope you all will pass. You all will come to the other side of the fence very soon. If you are having any specific problems, any specific issues, you can always reach out to us. No issue with that. It's going to just try to do one thing when you are giving grand test. Make sure you are giving at this point of time you should be giving grand tests which are oriented to your examination, like your those grand tests which are having the questions of pyqs. Okay, don't jump for the random grand test, otherwise what will happen at this particular point of time, you will lose your confidence. If you get less marks, what is going to happen, you are going to lose your confidence. So try to do questions which are more likely to ask in your examination. These are your pyqs. Pyqs has high tendency, like they are the recall questions, right? Apart from that, you will getting good marks in those pyqs, you will be getting extra confidence. Okay. Sharp timetable, I can give you the sharp timetable, but the thing is, I just want you to say that at this particular point of time, you should stuck with your timetable. Whatever you are having, if you are not having anything, you can connect with me. I can give you the timetable as well, right? But make sure in this last phase of your journey, you should be giving all the grant tests which are like PYQ oriented. Don't jump for those grant tests which are like a random grant test. Okay, तो फालतू क्वेश्चन नहीं करने. Make sure you give grant tests which are PYQ oriented. तो उससे क्या होगा, you will be getting good marks and you will be getting better confidence. Right? Last में all we need is the confidence. Right? I don't know why this is not working. This session will be having two parts. I will be covering it under 4 hours. 4 to 4.5 hours will be the time I would be taking. But this one is going to cover most of the things. Like I will be discussing about meningitis. Some questions are definite in medicine. They are always coming. They are always asking question on meningitis, on pneumonia, on myasthenia gravis. Okay, on your hemorrhagic disorders, like your brain disorders, like we are having EDH, SDH. Definite question. I'm going to touch upon only important parts, right? Infective endocarditis, definite question will be there. Management of arrhythmias, we will be discussing about that. Guys, I don't know why it's not working. Just yes, I will try to cover most of the PYTs. कितने क्वेश्चंस एक्सपेक्ट कर सकते हैं? क्वेश्चंस आई एम नॉट गोइंग टू टेल यू हाउ मेनी क्वेश्चंस यू कैन एक्सपेक्ट, बट आई एम गोइंग टू टच अप ऑन दोज थिंग्स which has been previously asked. Like the topics I am telling you, they are previously asked and they are having high probability, because last year also you are having question from myasthenia gravis back to back. You are also having the question from myasthenia gravis, right? So these are the topics. Like infective endocarditis, definitely they are asking questions along with the microbiology part, along with the medicine part. They are asking you the question, Jones criteria, your Duke's criteria. All these things are important and they are high likely to be asked again, right? Borau syndrome, your things. These are the things that has been asked, right? डरना is okay, beta. Darna is okay. If you are feeling that you are on the right track, if you are on the right track, then only you will be getting the things like anxiety and all. If you have not studied, you are not going to feel all those things. So Darna is completely fine. It's a part of the journey. Make sure what are the important things that you can do at this point of time. Make sure your sleep schedule is okay. Make sure you are revising your content, right now you should be doing the screening. Whatever things are important, they will be present over there. So you need to get these things out, right? For example, like in physiology, there are always questions from oxygen hemoglobin dissociation curve. You need to make it out, right? Acid base balance question will be there. Metabolic acidosis, alkalosis, I'm going to touch upon that. ABG analysis, right? So these are some questions. Like in microbiology, you will be having question from pneumonia, meningitis. Always they are asking question, pneumocystis cerevisiae, right? So these are the things you have to look for, right now what you can do, you can just go through your notes, mark out the important things, and whenever like in the last week, if you have everything for the last week, I'm just trying to reconnect. Okay, whatever things you are getting, like if you have content for the last week of your preparation, if you know what to study in the last 7 days of your preparation, you are good to go, right? In PSM you are having national immunization schedule, definitely question will be coming. Sometimes they are asking diluent, sometimes they are asking about the strains, right? So all these things are important. You have to mark these things. Right now you should be doing what? You should be going through the journey. You should be going through your pages, flip through your pages. Okay, mark what is important and what can be asked. Mark those topics that you are tending to forget, and these are high likely to be asked in your examination, right? Okay, I will be guiding you when I'm going to teach you about the meningitis and pneumonia. Okay, Yashwant? Right. Pediatrics I'm not going to take. I think Dr. Talib will be taking the pediatrics, and FMT I'm going to take. I will update you about the time, right? If you are having any particular issues, you can ask. I don't know what is happening with the screen. It's not working. And we can have one more session just before your examination. I would be telling you how to give the exam, because giving the exam is also an art, right? If you know what to do in the examination, that is going to be very, very helpful. I think if you are having any doubts till the time I'm fixing the screen, you can ask. Some topics are always important. You should be focusing on those topics, right? Let me connect with the Yes, I would be covering most of the things. Medicine is a vast subject. I'm not able to cover everything, but yes, it will be very, very helpful for all of you, because I will be touching upon all the important topics, all the tumors, all the important topics that can be asked in your examination. One thing I would like to say you, just go through your ECG basics first. Then I will be teaching you about the all the arrhythmias and all those things, how they are going to work. Like we are having atrial fibrillation, atrial flutter, all these arrhythmias I will be teaching you. 10 till 10 we are going to take the session. Once it will be started, the problem is the screen is not visible. I don't know, there's some issue. Sorry for the inconvenience, guys. I don't know why it is happening. If you are feeling any doubts till then, we can discuss about that. So let's utilize this opportunity also. Let's think positive. From today onwards, till the date of examination, make sure you will tell yourself the positive words. Don't think about 149, 148. Just tell yourself that you are going to make it. Screen is visible, but I am not able to write. Like my iPad screen is not visible. Whatever I am writing, it's not showing on the screen. You would like to answer some questions? Okay, tell me. Let's ask from micro. Tell me, what is the most common cause for pneumonia? Most common cause for community acquired pneumonia. Try to answer, guys. Most common cause for community acquired pneumonia. That is also the most common cause for meningitis as well. That is also the most common cause for meningitis and community acquired pneumonia. Try to answer. It's not happening. Very good knowledge point. That is going to be Streptococcus pneumoniae. What is the most common cause of pneumonia in neonates? Neonates. What is the most common cause of pneumonia? Neonates will be Group B, streptococci, that is going to be agalacti. What is the most common cause for meningitis? If they give you question of meningitis, they are giving you CSF analysis and they are writing the patient is also having the rash. What could be the cause? Patient is also having along with the symptoms of meningitis. What are the tried? What are the symptoms you will be finding in the meningitis? The patient will be having what? Nuchal rigidity. Patient will be having headache. Patient will be having fever. Apart from that, patient will be having some important sign. These are known as your Brudzinski and Kernick sign. Brudzinski and Kernick sign, right? Along with that, if in the question they have written you the rash thing, if the patient is also having the rash, what would be the cause? What would be the cause, beta? If rash is given, remember, if rash is given, the answer will be going in the favor of meningococcus. If there is cog web coagulum is given, not scarlet fever. If cobweb coagulum is given, that is going to be in the favor of cobweb coagulum is going to be in the favor of what? Which kind of meningitis? Which kind of meningitis? Cobweb coagulum is given. Which kind of meningitis it will be? Very good. If rash is given, that is going to be meningococcus. Ashley, very good. That is going to be your TB meningitis. That is going to be your TB meningitis. TB meningitis. Let's do one thing, guys. I'll just update the script. I'll just get resolved the technical part. Till then, like I will be giving you a new link. I need to stop this link and I will be giving you the new link and then we will be continuing. Okay. So if it is not working, we can reschedule the session because it is wasting your time and my time also, right? So let's not waste the time. And till then, just do one thing. When you are going to join next, just do one thing. Keep just understand about the things like read your ECG basics, go through your notes for cardiology, just faster, just you need to go through your notes. So, be thorough with the rheumatic fever, all these topics, infective endocarditis. You will be just go through your notes once, whatever notes you are having, and then whatever I'm going to teach you, you just I'm going to make you understand how to solve the question. So just mark all those important things in your notebook. Whatever important things I would be giving you, like I will be giving you integrated connections between the subjects, like how they are asking the question. So whatever things you are finding important, just mark it down into your notes and then we are good to go for the examination. Medicine will be covered, don't worry about that, right? So just do this thing. I'll just try to connect it, right?